Good morning, good afternoon, or good evening from wherever you are in the world. Assalamu alaikum wa rahmatullahi wa barakatuh from Durban, South Africa to the world. I am Bibi Amina Fili and this is Let's Sit Down. On today's edition, we speak about diabetics, the silent killer. And joining me to have this conversation is Dr. Sithole. Dr. Sithole, welcome to Let's Sit Down.
Thank you for having me.
Absolutely. Okay, so diabetes, as we all know, is the leading cause of mortality globally, as we all know, and resulting in almost 2 million deaths every year. Please educate our viewers and myself on what diabetes is and what symptoms to look out for.
Importantly, diabetes is defined as a medical condition where there is abnormally metabolism of glucose, which is blood sugar. It can either be too high, where it can actually land one in hospital, or it can be dangerously too low. And the low blood sugar is actually the most dangerous one. It is a medical emergency. Symptoms may range as high presentation, presentation with high glucose, as I've mentioned. Those symptoms can cause excessive thirst, excessive urination, excessive hunger. Some people can present with blurred vision or difficulty in seeing at night. Some people may present with complications of diabetes, which can be ulcers on the leg or numbness or loss of sensation in the legs. Even constipation, where there's paralysis of the working of the tummy, are some of the symptoms of diabetes.
Okay, so as we know, the poor are often the most affected by diabetes. Now, what medical advice can you offer on this regard?
Importantly, we say prevention is better than cure. So sedentary lifestyle is the underlying problem that leads one to diabetes later in life. So importantly, an active lifestyle is what I advocate for, because even when you don't have access, say, to vegetables every day, as you're mentioning, in the situation of people that are really underprivileged. But if you exercise, or if you have output for the energy that you are putting in your body is able to metabolize whatever you're putting into it much better than when you say for example, most of the food that you have access to is starch based, which is actually bad for your body, and you're not doing anything in terms of exercise. Unfortunately, that's where you find that the body eventually will give up, and you find metabolism issues and you develop diabetes.
Now, let's talk about stats and facts. Now, over 90,000 women in South Africa die yearly as a result of diabetes. Now, what specific measures may be taken to prevent this?
Importantly, as I've mentioned, lifestyle is number one. We mentioned already looking at active lifestyle in terms of exercise. But also, it's a sad thing that as much as we speak about underprivileged people, even people that have some access, like I'd say middle class, upper class people, we see a lot of diabetes in those individuals. So that tells us that diet is just, part of it, or rather exercise is part of it, but the main thing is diet. In fact, we say 80% of diet, of what we eat, is actually what we see in our bodies in terms of our health status now. So it's important that we don't take lightly what you eat from the morning till the afternoon or till the evening will eventually show in your body, and your diet, say over a period of 20 years, will unfortunately reflect on your health status in terms of your health.
That's true. Now, before the show, before we started this recording, we spoke about COVID-19 and how it affected us and how we were so surprised as to how it came to our doorsteps. Now, what risks do diabetic patients face during the COVID-19 era, and what health tips would you recommend?
Importantly, people who are diabetic are at high risk of any infection, and so that includes COVID-19. And we have seen that it worsens their diabetes control, and it's vice versa. In fact, even people with diabetes we generally see very severe presentations of COVID, where we see COVID pneumonia. A lot of them will require to be ventilated, hospitalized, and unfortunately we've lost some of them. And I must say that, you know, there is always hope. Some recover, they do go home. And ironically, there is actually something that is under research at the moment. A lot of people who were not diabetic before they contracted COVID-19 have survivors of COVID-19 are actually being observed to have diabetes, which is a new trend, and there's so much research by the South African Medical Council to try and see what is the link. Is it genetic? Is it does COVID-19 directly affect our metabolism? Or what is it really the cause of that COVID-19 sufferers or survivors have this diabetes that is new, and it's very severe form of diabetes. I have witnessed one person, in fact, who's one of our colleagues. So they like middle-aged individuals, and they develop COVID, and they have to be on insulin right from the start. So that's how bad the diabetes is. Importantly, I must say that people who are diabetic have to take extra precautions in terms of protecting themselves. There's still a lot of research that's going around about COVID-19. So please don't take all the myths and the things that are out there. You know, importantly, there are all these measures that are recommended for all of us to take care of ourselves in terms of prevention. So we stress those things. And when I say people who are diabetic must be extra careful, I'll give you an example. If somebody is working at a very high risk area, they should actually consider, and it's within their right to request, even in terms of work environment, to be put in a safer, yes, or an area where they have less contact with multitudes of people, because it's a fact that they are prone to acquire the infection very easier, and they are prone to have severe infection.
Okay, so now South Africa was the first country in Africa to introduce the taxation of sugar sweetening beverages, that's the SSB, right? So with the objectives of reducing the consumption of sugar products and substances, what health perspectives has proven necessary and helpful?
Importantly, the issue of sugar tax, personally, this is just a personal view.
Personal opinion,
it hasn't really done much in terms of
stopping the intake of sugar.
Stopping the intake of sugar, yes. But what I'm saying, it hasn't done much directly in terms of, you know, affecting diseases like diabetes, which was the whole motivation. I'll give on the contrary what I have observed, you know, through traveling. I've been to the Netherlands, and I was like shocked at how much the government was doing to make sure that they are very involved in the preventative measures to try and protect their communities from conditions that are lifestyle related, things like diabetes and hypertension. And I must say that they are much more strict when it comes to things like, you know, having certain things or foods or beverages on the shelves. And they go further to a point where you would never find some of the things that we actually still get sold. So basically, I feel that the way it has turned out to be, it's just that you are charged to, you know, put people at a health risk. You pay tax. But it doesn't mean that you are not
preventing it.
You're not preventing it. I'll give you an example. When you go to the Netherlands, you never find any sugar containing drinks in the fridges. It's not there. They don't sell it. And one other thing is you can't drive your car just to go to town or to go to the beach or whatever. You are forced to cycle to wherever you go. It's mandatory. I was laughing because when I got there initially, it didn't make sense. You'd see somebody on a suit and they are on their bicycle, and they put the socks inside. So I was laughing. By the time they get to work, I was like, I wish I could observe the creases on the
Yeah.
pants by the time they take off the socks. But what I'm saying is that that's how much Europe has put into the health of their communities. And I must say that they are saving billions, because if we look at the burden of diabetes, if you were to look at just amputations that happen in South Africa alone as a result of diabetes, I'd say about 500 legs are amputated per annum just in South Africa alone. And mind you, it's not just the cost of the surgery, the doctors looking after that person in hospital. The person gets complications sometimes. They go to ICU, and if they do recover at home, they might have had like a nice house with steps, and now they have to adjust. So those are the number. It actually just a replicative effect, like a domino effect. It's adding to the number of people that are disabled, and it just cuts their quality of life if they have to leave, past that amputation and survive the complications. But it's also a burden on their lifestyle then, because you can imagine when you suddenly, you were driving your Porsche, Cayenne, or whatever, and now you have one leg. You have to go and adjust your car. It's going to cost you money. You have to adjust access to your home. It's going to cost you money. You have to...
As well as buying prosthetics as well.
Definitely.
In sometimes.
So it's just an endless cost. So that's why I'm saying that, for me as an advocate for preventative medicine, we are doing dismally. And the sugar tax actually doesn't really add value.
Absolutely. Now, just the last question for this interview, just so we can end it off. Now, for a diabetes patient who is watching this video, what advice can you give them?
Importantly, once you are diabetic, I must say that the first thing is lifestyle. Even when I went to medical school, when it comes to treatment of diabetes, before we speak tablets, before we speak about insulin and injection, we speak about lifestyle. And I always say, even to my patients that I treat, even if we import you the best injection for diabetes, if you're still not eating right, and if you still don't feel the need to walk, it's not going to work. So if you're still having sugar, if you're still having starch uncontrolled, unfortunately, you are speeding your process of getting complications. And I always say to people who have long-standing diabetes, there has been a lot of evidence that proves that going on insulin early, it slows the process of getting complications. Because unfortunately, as someone who's diabetic, say 10 years down the line, 15 years down the line, your blood vessels are going to thicken and they are going to get affected, which is what causes complications in the eyes, kidneys, legs. So starting insulin early is actually very recommended. And I always, I'm a GP by profession as I practice. And I always encourage someone who has access to a specialist to see a specialist at least once a year. They can still see their GP, but it's important to see your specialist because they can do other tests that can only be conducted by the specialist. A physician, or see even an endocrinologist at least once, just to make sure that they stabilize your blood sugar control, and then you go back to the GP. Because you find that the same people that sustain complications, some of them are on the best medical aids, but they're not getting the specialist care. Because we can never undermine a specialist versus a GP. Like, say, if I know how to play golf, but I cannot compete with Tiger Woods. There is that even when it comes to medical care, that at least once see Tiger Woods and you get that expertise.
Well, thank you so much, Dr. Sithole, for joining us.
Thank you.
And thank you for watching today's edition of Let's Sit Down with myself, Bibi Amina Fili. Don't forget to join us every weekend as we give you your amazing dose of what's happening around us. Don't forget to like us on Facebook and follow us on Instagram. And if you'd like to send your feedback, you can send it to Let's Sit Down with the South Africa @gmail.com. From us here, the team, it's a goodbye for now.
جيت عالدنيا وفي أول ثانية فتحت عيوني خرجت من السكون